happy to be back this morning on Health Matta on WAP TV. This morning we'll be discussing a topic we started last, and of course that is kidney transplantation. What is it all about? I have an expert in the build that will do justice to this topic. He is a consultant nephrologist that works with Lasuth here in Lagos. Dr. Theophilus Umeizudike, I welcome you to today's program.
Thank you very much, sir.
Thank you for being with us last week, sir. We're happy to have you back. And this morning we'll be continuing from where we stopped. We couldn't actually finish. It's a big topic and we couldn't finish it. Okay, so we started last week by giving a bit of history of where it all started. Several unsuccessful attempts that were made in trying to do a kidney transplant from animals to animals that didn't work until eventually we had a very successful one that lasted for about 8 years, okay? Talking about the one that was done in the year 1954, the kidney transplantation that was done in the year 1954, okay, between monozygotic twins, identical twins. That was performed by Joseph Murray, and that man eventually won the Nobel Prize for Medicine in the year 1990 for his efforts. Over the years, advancements along that line have continued. And of course, today, earlier this year, we heard about the news of the first successful transplant that happened, where you have a genetically modified clinical grade pig. A kidney was taken from such an animal and transplanted into a person that was already brain dead. And of course, there was some degree of success. So you can see that kidney transplantation has evolved over the years. And why is this so? A whole lot of people are on dialysis, are on waiting list. The average waiting time to get transplanted with a kidney is said to be between 3 to 5 years. And you can imagine that because the number of people that are coming down with CKD, end-stage renal disease, are alarming and increasing by the day. This morning we'll be laying emphasis on what we can do to prevent this upsurge in the numbers. One of the things that we have been told can cause chronic kidney disease is uncontrolled diabetes and many other disease conditions. Unfortunately for us, we have somebody, an expert, who will be talking to us in all of this. And I would like to yield the floor to you at this point, sir. So what is kidney transplantation? Where are we now? Thank you very much, sir.
All right, thank you for having me again. It's a pleasure to be here to educate the populace on the topic of kidney transplantation and also to talk a bit about how we can prevent this. It's a process through which a kidney is taken from someone who is alive, in the case of a living donor, and given to someone who needs it, either somebody who has been diagnosed with end-stage renal disease, or somebody who is at a critical stage, maybe stage 4, or somebody who has failed a kidney transplant that has failed. So it could be either of those 3 conditions that you give someone a new kidney. And we said last week that we don't usually touch the failed kidneys, but we just put in a new kidney and we know that that kidney will work. And just one kidney is enough to sustain life because some people are actually born with just one kidney. But the thing about transplant is after it's done, the surgery is successful, the recipient will need to be on a lifetime, have to be on lifetime immunosuppressive drugs, which we know is available in our country, but is also very expensive. But compared to dialysis and living doing dialysis, whether it's 2 times or 3 times a week, or in advanced climes when people do home dialysis, it's a far better way of treating end-stage kidney disease than being on dialysis. So transplant offers a far better life in terms of qualitative. Some people after a transplant are able to regain their sexual functions, like women are able to have children. Men that had some erectile dysfunction are able to recover it. Some that had sleeping problems are able to recover. Restrictions in terms of diet and food is also, in a way, relaxed. Then also intake of water is encouraged that such people take water. But of course, they can't just mingle or do anything like they like because they have just one kidney. and they need to be mindful of the medications they take, because some of the medications that other people take and won't have issues, when they take it, it can interact with their immunosuppressive drugs, so they need to consult their transplant physicians when they are taking any medications at all, to be able to guard against drug-drug interaction that can be inimical to the life of to the new kidney. So looking at it and saying, how do we prevent kidney disease and chronic kidney disease, which is what ultimately leads to somebody needing dialysis and transplant? We look at the causes of chronic kidney disease in our climate compared to developed world, where diabetes is the #1 cause. In Nigeria and most parts of Africa and other parts of developing world, the #1 cause of chronic kidney disease, which is irreversible kidney disease that ultimately leads the person to needing dialysis and transplant, is hypertension. And in our society, close to 20 to 30% of our population is affected by this hypertension. Out of this number that is affected, over 50% of them don't even know that they have hypertension. So I think the lesson that some people should take away from this is that you should make sure you check your blood pressure regularly. It's not an everyday thing you should check, but at least maybe once a month, or once in 2 or 3 months, check your blood pressure, especially when people get to about the age of 30. Even people in their 20s, we've seen them come down with kidney disease. And last week I talked about people having to do some tests, okay, just to know where your numbers are, because hypertension is not just the number of 140/90. 140/90 is the cutoff, but we know from studies that even before that 140/90 is gotten to, some people may have what we call target organ damage, which can be in form of kidney disease, or it could be in form of heart disease, or it could be in form of a stroke. So we need to look at the numbers, not just the numbers, but also other associated conditions like high cholesterol, like diabetes, and some other things that could come along. So #1 cause is hypertension. If we can be able to do our best to prevent it, and if we can't prevent it, those that have been diagnosed with hypertension should do their best to treat. Take your medications every day, and apart from taking the medications, you also do what we call lifestyle modification in terms of doing exercise on a daily basis. If you can't do every day, you do about 5 days in a week. And also you need to cut back on your salt intake, because salt has been linked to hypertension among blacks. Blacks are unable to excrete salt like the Caucasians, so we need to cut back on our salt. The best way to do that is actually to reduce eating out. If you can make your meals at home, that's maybe bad business for some people, but that's the honest truth. If you can reduce the salt, there's a body that is saddled with the responsibility of actually checkmating the amount of salt that is added to processed food. And they've been able to, in some climes, been able to put some kind of benchmark on the amount of salt that should be in processed food. And they also go out to approach big eateries to tell them that, look, let's reduce the amount of salt we're putting in our foods. So in a way, that will also reduce the amount that people who come in to patronize them consume on a general basis. So if we're able to do that in our climate, and we're able to interface with these big eateries and be able to reduce the amount of salt they put in their meals, it will also reduce the amount of salt that people eat when they visit such places.
Thank you very much. Talking about salt, what about other forms of diet? Sticking to Western diet instead of the healthy ones that we've been told about, the so-called DASH diet.
Okay, so looking at that, processed food is generally not the best. And processed food, I mean snacks, soft drinks. Like I said, it could be bad business for some people, but if we are able to control that and reduce that, people will be able to eat what is closer to nature by eating fruits and vegetables on a daily basis, and also making sure that you eat less of those processed food. Yes, once in a while you can take snacks, you can take soft drinks, but it shouldn't be a daily thing. I see people take soft drinks and instead of taking water. Water is much more healthier way to cleanse your system than to take soft drinks. So if you drink water about 2.5 to 3 liters daily, that will ensure that you push out up to 2 liters of urine on a daily basis. So that's healthier. So not making much of it. Let's find a way to eat much more of less processed food and more of cooked food. I mean, our eba, our amala, our gari, the rice, beans, those are quite good meals that can help us live a healthier life. And if you look at, some people will tell you that our grandparents or the people of old who lived in villages, they lived healthier lives. So if you look at the pollution in a place like our city in Lagos, it's quite enormous. Those things contribute in certain ways, not just to airway disease, but also to cardiovascular disease that can influence hypertension. So pollution also, in a way, leads on to health, worsening people's health status. And then you also look at conditions that are easily preventable. People who are pregnant women who have hypertension, and they are detected during pregnancy in the course of the antenatal care. If these people are well cared for and if they are well cared for during pregnancy and afterwards, it may be necessary to continue to monitor them to be sure they don't continue to have that hypertension that may ultimately lead them to developing kidney disease. Of course, conditions like kidney stone also, which was discussed some few weeks ago, those are conditions that could also impair kidney function and lead to chronic kidney disease. So one way to prevent kidney stone, if someone didn't hear much about that, is make sure you drink enough water. Water, water, water. You're likely not to go wrong taking enough water. The only people who restrict water from are those who are on dialysis because of the fact that their kidneys are not functioning optimally and they need to regulate the amount of water they take. They should not take free water like other people who don't have kidney disease. So other conditions that could also affect kidneys are conditions like HIV. The coming of COVID seems to have taken the shine off HIV, but HIV is still prevalent, even though the figures in the country has dropped a bit, but it is still a topical issue that should not be overlooked. So people who have HIV need to take their medications. Apart from taking their medications, they need to run tests on a regular basis to be sure their kidneys are not affected. If their kidneys are affected, they need to see a nephrologist who will be able to manage the condition alongside their primary doctors who take care of their HIV. Conditions like hepatitis B and C also are known to cause kidney disease. So they should be treated. They should be promptly treated. That's why also in doing a regular health check, you check for these viruses. Check your hepatitis status, check your HIV status. Those are ways that you can prevent early time bombs that could be nicking, that might be ticking.
Thank you very much, sir. Now, talking about conducting some tests to actually dictate, I say this because some of these medical conditions that we have talked about, for instance, hypertension can be referred to as a silent killer. Why? Because oftentimes the person who has it may not be in the know that he or she has it. Ditto for diabetes. Somebody may have it for many months and many years and may not know before it begins to manifest. What will be your advice to guard against such? Because that is usually the narrative in our environment. Are there simple basic baseline tests that can be done, that an individual can do to get to find out some? We have two categories of donation: living donors and deceased donors, non-living donors. Formerly was called cadaveric donors. Okay, so but that is actually the future of kidney transplant, and you can see how far science has taken us. Now they're trying to see if genetically modified pig kidneys can be transplanted to human to guard against organ shortage. That's an interesting one. Usually, some of these chronic illnesses, they don't manifest. The individuals who have them may not even know that they have this disease. Talking about hypertension and diabetes, are there simple tests that individuals can do, can just walk into a hospital or probably go to a diagnosis center and request to have such tests done to at least give them an idea Thank you very much. I would like you to educate us on that.
Okay, so start with the urine test. A urinalysis that is done just on a routine basis. It could be an annual check. It could be part of pre-employment test. It could be part of preschool and many other places that you want to come into and you're asked to run a test. So just take your time to run that urine test. It could just be a way of detecting early form of the kidney disease, which the person will completely be asymptomatic. And of course, also checking the blood pressure. And in the urine, let me just say, in the urine, there could be blood, there could be protein, and there could be other substances that may be things that we need to evaluate further on. The person may need to undergo a kidney biopsy that will be able to help diagnose early form of kidney disease, and that can then be treated and potentially treatable conditions that will not, that will prevent the person progressing to end-stage kidney disease and needing dialysis and transplant. And of course, the person could also do an abdominal scan that will tell us the size of the kidneys. So if the scan is done and the kidney size is evaluated, it helps to also be sure that the person's kidneys are healthy. And checking the blood pressure is something that so many people take for granted. But knowing the numbers, like I said, is one thing, and doing something about it is another thing. 140/90 is the cutoff for hypertension. So if somebody's blood pressure on more than one occasion is found to be persistently elevated above that, or even at that level, the person should institute treatment. And treatment most times is lifetime. So checking for the blood sugar also helps. So fasting blood sugar and 2 hours after a meal, and also glycated hemoglobin, because it's becoming knowledgeable now that you can't just do the blood sugars. You need to do what is called glycated hemoglobin to be able to diagnose diabetes in quite a number of people. So going on from there, if you also check cholesterol, because in some kidney conditions, the cholesterol is abnormally very high. And so if high cholesterol is detected, then it may be, it's not just kidney disease that causes it, there are other conditions that will cause someone's cholesterol to be high. Then do an electrocardiogram to see how the heart is, because there's this connection between the heart and the kidneys. If the heart is not working well, it's likely to impact or impair the functioning of the kidneys. So ECG or echocardiogram goes a long way to help.
Yeah, we have Solomon from Castina. Good morning, sir.
Good morning.
How are you today?
I'm fine, thank you.
Thank you very much. You have the floor, sir.
Yeah. Thank you for the wonderful job your people are doing over there.
Thank you very
We
much,
are
sir.
very grateful. Please, my question is go like this. Are you with me?
Yes, yes. Go ahead.
How can hypertension cause kidney disease? Because I believe hypertension is on its own and kidney disease too is on its own. So I want a little bit analysis on how does it go together.
Thank you very much. Thank you very much for that very key question. I will allow the consultant in the house to take the question.
So hypertension essentially is a blood pressure that is above normal, and when that persists, it affects vital organs. Kidneys is one of them. It affects other organs like the eyes, the brain, could to cause a stroke, the heart to cause either heart failure or ischemic heart disease, and of course the kidneys to cause kidney failure. So if that high blood pressure persists and is not treated over years, about average of about 10 years or plus, but in some people it could even be less than that, it can affect the kidneys or even other organs. There are people who come into the emergency room with a blood pressure of severely elevated blood pressure, and they are in coma because they've suffered a stroke. So blood pressure targets some vital organs like the eyes, the brain, the heart, the kidneys, and the vessels. So those are the 5 critical organs that the high blood pressure targets. At the same time, there's also a condition that is called chronic glomerulonephritis. It's a big word for just inflammation of the kidneys that can arise from many conditions that have affected the kidneys over months or years. So when that chronic glomerulonephritis happens, it can then lead to what we call secondary hypertension. That means the person ab initio has kidney problem, which when it has gone on for months or years, then leads to hypertension in such a person. So there's that relationship between the kidneys and hypertension, as well as hypertension and the kidneys.
Thank you very much. So in other words, hypertension can affect the kidneys, and also the kidney can equally cause hypertension. BC from Lagos, good morning, ma'am.
Good morning. My name is Ijani. I just want to appreciate Dr. Len and the participants of this program.
Thank you very much. Thank you very much.
And I think it will have been given a wider advert so that a lot of people can benefit from it. Thank you, Dr. Len. Thank you for this program. God bless you.
Thank you very much. God bless you, ma'am. Now, I had a practical experience I want to share with our viewers. Okay, so yesterday, about the first patients I saw in my facility, this was a gentleman who prior to traveling home for Christmas had no such issues. Okay, but he was placed on some certain drug, prednisolone, by doctors, and he took it for a period of close to 2 months. And then he started having all sorts of weaknesses and symptoms, urinates frequently at night and all whatnot. So he got very disturbed and called me and said he should come for checkup. Just like what you said, we did just only 2 tests and we were able to detect what the problem was. We took his urine sample and sent for urinalysis, and lo and behold, his random blood his urinalysis came out with 3 pluses of sugar in the urine. Remy from Ogun, good morning.
Good morning, sir.
How are you today, sir?
Fine, thank you, sir.
Yeah, please go ahead.
Okay, thank you, people, for what you are doing.
Thank you, sir.
May God continue to strengthen you in Jesus' name.
Amen. Amen. Thank you, sir.
So my own question is this one. They talk of kidney stones. And some people, medical people, they say, okay, there's a way you, the way you eat and what you eat that can remove those stones. Then some people say, okay, maybe eating bitter leaf or so cleanses the kidney. So I just want to ask what I don't want the doctor to enlighten me more in that area. How does one cleanse the kidney stones with the way we eat?
Thank you very much. Thank you very much. Chief, over to you, sir.
Well, so essentially the most important factor in treating kidney stone is just to try and prevent it by making sure you drink enough water. So water. Like I said, you're not likely to go wrong drinking enough. It's only people who have some significant degree of kidney impairment will try to limit the amount of water they take, because one of the things the kidney does is to make sure that the amount of water you take in is removed when the body has been able to get to a near equilibrium. So when you take more water, you're likely to reduce the chance of your kidneys forming stones. In our environment, it's quite humid, it's quite hot, so you sweat a lot, and so you need to drink not less than 2.5 to 3 liters every day. Okay, some people may even have to drink more than that because of the nature of their work, exposure to sun, and some other conditions. But by and large, about 2.5 to 3 liters is fine. But like I said earlier on, before you start drinking that much, it may just be necessary to be sure that your kidneys are healthy to be able to accommodate that volume before you go ahead to take that volume. So, yes, the kidney stone, there must have been discussed some weeks ago. There are certain things that cause it, and you need to be evaluated to know what may be causing it.
Emmanuel from Plateau State.
Yes, sir.
How are you today? Good morning. We'll come back to that, sir. Okay, so let's have your question.
I have diabetes.
Okay.
And I heard that one has to take drugs throughout his lifetime. Is there no remedy to diabetes completely, unless I go on this drug completely for the rest of my life?
Thank you very much. Over to you, sir.
Valid question. Just like people ask me, each time I tell them that their hypertension, they need to be on medications for a lifetime. So research is ongoing, but for now, you need to take your medications every day and also do lifestyle modification, because one of the things the kidney does is to make sure that the amount of water you take in is removed when the body has been able to get to a near equilibrium. So when you take more water, you're likely to reduce the chance of your kidneys forming stones. In our environment, it's quite humid, it's quite hot, so you need to drink not less than 2.5 to 3 liters every day. Okay, some people may even have to drink more than that because of the nature of their work, exposure to sun, and some other conditions. But by and large, about 2.5 to 3 liters is fine. But like I said earlier on, before you start drinking that much, it may just be necessary to be sure that your kidneys are healthy to be able to accommodate that volume before you go ahead to take that volume. You can't afford to eat anyhow when somebody has diabetes. You need to look at what you eat, and with your eating and exercise and medications, you're likely to be able to control it and not have much issues, because of the fact that these are diseases that have to do with organ dysfunction or malfunction. So in diabetes, there are two types. There's type 1, in which there's absolute insulin deficiency. The person has to be on insulin for a lifetime. In type 2, there is insulin, but it's in excess, and it's actually not able to work at the level of the tissues. So the person needs to lose weight to be able to enable the excess insulin work. Then the person also needs to be on medications that will enable the tissues to take up glucose and be able to utilize it. Because, like somebody has said, diabetes can be described as there's so much sugar in the system, but it's not getting into the body. So you need to do your lifestyle modifications. You need to take your medications, and that goes a long way in preventing the long-term complications like kidney failure, eye disease, heart problems, stroke, and many other conditions that diabetes can cause in the body. So you need to take your medications for now. With time, we may have things like islet cell transplants, which is already happening, where someone can get a transplant of islet cells, which produces insulin in the body. But for now, it's not a preferred treatment for diabetes. But never say no. Science is evolving, and perhaps with time, there might also be some injections you can take. Like I know there is a drug being developed for hypertension that can be taken maybe once in 2 weeks or once in a month that can regulate somebody's blood pressure. But those are still under investigation, and they've not become very well.
Thank you very much. Ibrahim from Benue. Good morning, sir.
Yeah, good morning.
How are you
Good morning.
today?
Thank you. I'm fine.
Yeah.
Thank you for a wonderful job that you are doing.
Thank you very much.
We really appreciate it.
We appreciate it too.
Yeah, my question is, for over some years now, I've been experiencing incontinence. So I would like to know whether the sign of kidney disease or maybe the kidney heart issue.
How old are you, sir?
I'll be 42 by October.
Okay, thank you very much. He has been experiencing urinary incontinence. So,
yes.
Yeah, thank you very much. He wants to know, does it have to do with kidney problems?
Not likely. That sounds like something that has to do with the urinary tract. Likely not. If it's a younger person and
his age is 42.
Yes, so younger people, it may be kidney related, but not at this point. So there's something wrong with the urinary tract that needs to be evaluated. It needs to see a urologist to be able to evaluate him very well and be able to get a solution to that. But of course, something like diabetes, if someone has diabetes, it could cause some form of nerve dysfunction that can affect the ability to hold the urine. So that may need to look into that. But I think it needs to see a urologist to evaluate.
Thank you very much.
Yeah.
Thank you very much. Now, back to the practical example I was giving the last time concerning the gentleman who came in with all sorts of complaints, unexplained weakness, frequent urination. We just needed to do 2 tests to clinch the diagnosis. Number 1 was random blood sugar, which came out as 350 milligrams per DL. Okay, so the second one was that we sent his urine to the lab, and it came out with 3 pluses of sugar, glucosuria in the urine. And right there, we ordered for additional investigations to be done. Now, he was told that this is diabetes in the picture. Okay, so that is how simple it is to make some of these diagnoses with very simple, cheap tests that do not cost so much. And then transplanted to Hispanic man. So it does not discriminate against gender. It can be from female to man and from man to woman. And of course, from the Hispanic man who unfortunately had an accident 2 years after we were told, the same kidney was retrieved and transplanted to a black woman. Wonderful work from the scientific community. The list of what can be done is endless. I can assure you of that. Chief, such an interesting story here.
Yeah, it is. Very...
White thin girl to Hispanic man, and of course to a black woman. It is. Now, let's go back to some of the contraindications, because people need to know. I came across some of the contraindications to kidney transplant, and I read about smoking, substance abuse, harmful use of alcohol. Does it mean that anybody who indulges in all of this may not be qualified to receive a kidney transplant? Should there be a need for such?
Okay, so there are absolute and relative contraindications to a kidney transplant, and you've mentioned some of them. Others will include people who have a cancer, many cancers that will not allow the person to survive beyond a particular number of years. You don't want to transplant that, and the organ may be still okay and the person is passed on. Also, if someone has severe cardiac heart disease or severe lung disease, you may not want to transplant such because they may not survive for so long and the organ will still be viable. And so also you also look at people who have infections. So infections like tuberculosis should be treated.
Suleiman from Castina, just a minute, sir. You have the floor, sir.
Yeah, good morning.
Good morning once again.
Thank you. Please, I want to ask doctor, I understand that when you have a kidney stone or you have a kidney disease, when you drink a lot of water, you would be cured. I don't know how far it is true. Number two, I understand that when you drink a lot of water, you continue pass urine throughout the day. And if it is that is how you pass urine through, is it advisable to be drinking a lot of water and be passing out urine frequently?
Right, so kidney stone, I did say that to prevent it, you take lots of water, but that has to be taken with caution also. If you live in a place like Lagos where you can be stuck in traffic for many hours, I won't advise you to drink so much until you get to either your office or where you can easily get a restroom, right? So you should drink early in the morning and maybe about before midday, and then when it's getting to 6, 7 p.m., don't drink so much after that so you don't have to wake up so often to urinate, and that can disturb people's sleep and make sleeping a headache. So just try and drink within your waking hours from the time you wake up till about 6, 7 p.m. in the evening. And also look at what your schedule is like for the day. If you're going to be going now to offices that you may not be able to get easy place to urinate, then you may need to adjust and see how you do with that. Kidney stone is treated not just with taking water, because there's a critical size that the stone must be that it can easily be passed out through the urinary system. But beyond that size, it needs to be treated either by surgery or by lithotripsy to be able to get it out. So it depends on the size of the stone. If the stone is beyond about 3 millimeters, it cannot come out. It needs to be treated, and so you need to see a urologist to help to sort it out. Yeah, that's it.
Thank you very much. Paired exchange, we saw it in one of those videos. That seems to be another good option for a lot of people who are having or who are on the waiting list.
Yeah.
Is that available in Nigeria at the moment? Are there plans to have that in Nigeria, or can Nigerians join the paired exchange with the Western world?
So the paired exchange.
What is it all about, so that our viewers can understand?
The paired exchange is like donor A wants to donate to recipient B, but the blood group does not match because you need to cross the barrier of blood group or HLA before you can actually donate. So if A wants to donate to B, they must share the same blood group, or A must be blood group O. But suppose A is blood group B and B is blood group O.
Just like you have in blood transfusion.
Yes, just like a blood transfusion. That's A cannot donate to B. But look at the scenario that C wants to donate to D, and the blood group of C matches that of B, and the blood group of A matches that of D. Then they can do a paired exchange. All right, so they can cross over and donate to each other. But usually what is done is that the surgeries must take place the same time so that nobody says, oh, my donor has donated for you and then your donor is not available to donate for me. So the surgeries take place simultaneously at the same time and it's sorted out. So that's a way of removing the barrier of either blood group barrier or HLA typing. So sometimes again HLA does not match between A and B, but it can match between A and D and C and B. So you can do that paired exchange and be able to get people to donate in spite of the barrier they might have with their original donors. It's available in some centers in Nigeria.
Thank you very much. Thank you very much. Now, I want us to look at aftercare for people who have undergone kidney transplantation, people who have had kidney transplant. Oftentimes, I've seen people who traveled abroad, a lot of them to India, to go and do a transplant. When they come back to Nigeria, they seem to have one or two challenges along the line. So what advice do you have for such individuals, or even people that did a transplant in Nigeria, aftercare, in terms of what the person needs to adhere to, diets and otherwise?
So kidney transplantation is not just like any other surgery that you do and you go home and everything is fine. Yes, the new kidney is working, but you need to constantly visit your nephrologist. Those who have gone out of the country, whether to India or UK or US or any other country, when they come back home, they should identify a nephrologist that can care for them. Sometimes people want to maintain emails or phone calls, but that's not the best.
Let me pause you. Lola from Kwara, good morning.
Good morning. Thank you very much.
Yeah, thank you. Go ahead.
Okay. I wanted to find out when I'm participating. Thank you very much. Good morning.
Thank you. Just turn down the volume of your TV set and you're good to go. Thank you. Yes, go ahead. Oh, I think we lost that caller.
So other things that needs to be done is the person must maintain their medications. I talked about the 3 basic medications: a steroid, a calcineurin inhibitor, and an antimetabolite. So they need to take it every day. And I usually advise people they always must have at least 2 weeks to a month stock of those medications at any point in time. And taking that and also doing their tests as at when due, to be able to detect any form of malfunction of the new graft early enough so that interventions can be done. And in taking the calcineurin inhibitors, there's need to also monitor the drug level, because we want the drug to be within a particular level, not too high and not too low. If it's too high, it could affect the kidney. If it's too low, it could lead to rejection. So they need to monitor the drug level of either tacrolimus or cyclosporine from time to time. Same happens with sirolimus, which is another drug that can be used. So the drug levels need to be monitored from time to time. And like I said earlier on, people who have done a transplant are able to go on and have children. So in such a situation...
What about diet?
For diet, there isn't much of restrictions in terms of diet. Okay. But of course, salt is still not the way to go. You can't still eat lots of salt. You just take the basic minimum. Restrictions in terms of other dietary intake is not so much anymore, okay, because they have a good functioning graft.
Can such a person take a little bit of alcohol?
Well, so in developed climes, it's said that alcohol helps the heart. But I also look at it that in those climes, they have health insurance that covers them if they need to do a transplant, whether a kidney or a liver or a heart transplant. We don't have such covering in our environment. So I just tell people you have to choose between one and the other. Do you want to be healthy? Do you want to take alcohol that can affect not just the heart, but also the liver? So you look at the merits and demerits and say, I think I want to live a healthier life. Alcohol may not help you lead a very healthy life. You can tell us stories of people who have drank alcohol for many years and they were not affected, or smoked for many years and they were not affected. But there are things that we know that definitely have impact on the health. And if we know such substances or such things, I think we should avoid them. They are better avoided. Yeah. So other things that they should also do is to make sure that they don't eat uncooked food, because of the fact that their immunity is suppressed. So they might tend to have some form of GI upset if they take food that is not cooked, because of the fact that those food may not be clean enough to avoid germs coming into their system. And of course, they need to do a regular check with their transplant physicians and be sure that their numbers are okay and that every other thing is fine. Yeah.
Thank you very much. Still talking about diet, there's this insinuation that a particular tribe in Nigeria has kidney challenges more than the other tribes. And there's this suspicion that it has to do with their diet. Is there anything like that? There's, I don't know the English name, camu or potash now that people use in making isewu and a number of other delicacies. Do they have a role to play in CKD, as some of the causes of chronic kidney disease? Okay,
so of recent, to the early 2000s, a gene has been detected called apolipoprotein 1 gene. Incidentally, a study has been done in some parts of the southwest and southeast and the northern part of the country. And the number, it's close to about 30% in the southwest. In the southeast, I think it's about 35–40%. In the north, it's not so. The gene was not found to be very prevalent in the north. And that makes us feel that apolipoprotein 1 is a strong factor in leading to people in the southeast or southwest coming down with kidney problems compared to other parts of the country. So, but always in any disease, you talk about interaction between the gene and the environment. So the potash may also contribute, but the genetic factor is quite strong and has been documented in African Americans and people who migrated from here to other climes.
Thank you very much. It's on that note that we want to say a very big thank you. Chief, thank you for coming once again. And of course, to our numerous viewers in Nigeria and around the world, we thank you too. So see you next week.